Hi, I'm Sarah, and in this video I want to talk to you about sitting on the birth ball. Why women in pregnancy are encouraged to sit on the birth ball. So there's two reasons why women are encouraged to sit on the birth ball. The first one is for comfort. In pregnancy, women can get tired, sore backs, and when we sit in the ball, it's just really relieving. It's comforting to sit in the ball, and it relieves that ache that we can get in our backs. The second reason is about getting the baby into good position for birth. When the baby is in it's on the left hand side, and with the back slightly to the front, it leads to an easier labour and birth because our body is designed to rotate the baby from that position to give us an easier birth. And why that is, you can see in this picture now. On the left hand side of this picture you can see a baby's head which is fitting well down into the pelvis. The chin is tucked onto the chest, and the part of the baby's head that's on the cervix is going to open that cervix very efficiently with each contraction. The picture on the right is different. You can see there's more water in front of the baby's head. The chin is not tucked into the chest, and there's more water there because the baby's head isn't fitting as well down into the pelvis. And when the uterus contracts with the baby in this back-to-back position, the contractions aren't as efficient, so that it takes more contractions in order to open up the cervix. And it leads to a stop-start labour, which can take a lot longer than a labour where the baby's back is to the front. So for these reasons, that a labour will start spontaneously when the baby's back is to the front, there's less likelihood that the bag of waters will release before labour starts, and there's less likelihood of intervention when the baby's back is to the front. For these three reasons, it is important that we focus on getting baby into good position for birth. And sitting on the ball is a really, really big help to do that. When we sit on the ball, we sit in the UFO position, which is upright, forward and open. The upright is just that we have to sit upright sitting on the ball, and this helps move baby down into our pelvis. We also sit slightly forward, and when we sit slightly forward, we've got gravity bringing the baby's back to the front, all right? Because we have a hammock now at the front in which baby's back will rotate into. If I'm sitting back like this, like sitting on a couch or on a recliner, the baby's back, like us, will rotate its back into the hammock. You'll never see somebody lying like this into a hammock. And baby is the same. If our backbone is the hammock, they'll swing their back into it. Whereas if we're leaning slightly forward, our bump becomes the hammock and the baby's back goes there. So we need to sit slightly forward. And the O is for open, that our pelvis is open, giving baby room down to move down into the pelvis. It's kind of difficult to sit cross-legged and elegant on the birthing ball. We're more comfortable sitting like this, and baby is more comfortable when we're like this. It gives the baby more room to go down to the pelvis. We're not squishing the baby out of our pelvis. So that's the UFO, and why it's better for us to sit in this position while we're pregnant, and help baby move down, and leads to an easier birth. Now, in relation to what type of ball to get. So it's really important that the ball is anti-burst. So that doesn't mean that it won't burst at all. It can burst, but if it does burst, it goes down slowly, so you don't go with a bang. The other thing that's important is that it's the right size for you. When you're sitting on the ball, your knees should be below the level of your pelvis. Right, this is important. So this ball is a 75 centimetre ball because I'm taller than average. The average woman should sit on a 65 centimetre ball, and the smaller woman should sit on a 55 centimetre ball. But what's really important is that you check every week just to make sure that the ball is up high enough, because obviously they lose a bit of air over time, and oftentimes women will come into the hospital and the ball is down really low, and that's not efficient and it's not helpful. So just make sure that your knees are below the level of your pelvis. So that's it. We encourage you to sit on the ball from 34 weeks or earlier because it's just really, really comfortable. Make sure it's the right size for you. And thank you very much for watching, and hopefully I'll see you again at another video. Thank you.